Dr. John Lucio. I practice integrative medicine and pain management in Jefferson City, Missouri. Welcome to our channel, and this is my wife.
Hi, I'm Dr. Jennifer Sue. I practice conventional gynecology and integrative medicine. Welcome back to our channel. Today we're going to talk about pain with sex. This can cover a variety of different conditions. We're going to cover this by looking at the 3 areas that could be causing you pain.
And just to be clear, she's going to be talking about painful sex from the women's standpoint. So
that's
going to be discussing more of the women's anatomy than the men's.
We're going to be covering also some sensitive material, so if you have some young listening ears, you might want to get them busy in another part of the house. If you haven't subscribed, please do so. Hit the like button and also hit that notification bell down there. How we thought we'd organize today's video is that we're going to talk about 3 areas that could be causing you pain. Either the outside of the vagina or the entryway, the vagina, or the area up above, which is your pelvis. So we're going to talk about those 3 areas and things that you can do to help those 3 things in terms of either diet, botanicals, vitamin supplementation, and physical activities and referrals to other specialists if that can help you. If we're talking about the entry of the vagina, we could be talking about size mismatch. So whatever you all are trying to put in your vaginas during sexual activity is not matching with the size of your vagina. Either the size is too big that you want to put in your vagina or the vagina is too small. If your vagina is too small, what you may want to do is try manual vaginal dilators. They're bought over the counter. They come in a variety of sizes. So if you have a very smaller vaginal diameter, you would get the smaller kit. If you have a larger vaginal diameter to fit the larger object, you would get the larger kit. And you want to place the smallest vaginal dilator in your vagina and hold it there for at least 15 minutes minimum 15 minutes every single day. And then once that's comfortable, then move up to the next size. So basically you're just manually dilating, let your vagina get used to those sizes. If you're talking about treatment from either radiation treatment, which is due to cancer, or menopause, those are hormonal problems. You've had hormonal deprivation of that vagina and scarring. The vagina responds really well to hormonal treatment. So you may want to talk to a practitioner who's really comfortable with hormonal treatment of the vagina. The 2 available hormonal options for the vaginal area for hormones is a product called estradiol and another hormone called estriol. Estradiol, as it's pronounced as diol, which is 2. E2 is a very useful estrogen that's the most biologically similar to what we have in our body. And when you apply this cream to your vagina, it's actually working and gets absorbed some into your system. Very good absorption rate. When you use E3, which is estriol, it's a very weak estrogen. So that effect is very weak. It's going to stay right in your vagina, but the downfall is they might not get absorbed as well. I like to use E3 cream on my patients who have some sort of need for that and they're still menstrually cycling, because I don't want to add too much estrogen into their system with the estradiol. If you're someone whose entrance of the vagina is scarred by something like lichen sclerosis, which is a condition of very caked on dry skin causing tremendous itching and scarring and cracking and bleeding, making sex impossible, the number 1 treatment for that is a strong steroid cream like clobetasol. Clobetasol is useful. If that doesn't work, then you can try non-surgical options like the O-Shot, and you can find lots of providers for that on www.oshot.com. This is done very successfully because how we do it is we inject your own platelet-rich plasma underneath the area of the lichen sclerosis, causing your own stem cells to target that area and to really heal your lichen sclerosis. And it's a non-surgical approach, which is really good. If the entrance is just dry because either your partner is impatient, the partner cannot wait for you to have enough lubrication to insert the object they want to, then you might want to invest in some kind of lubricant over the counter. There's 3 different types. There's a water-based, an oil-based, and a silicone-based. Most women prefer the silicone-based lubricant because it has a lot less irritation with prolonged sexual activity. We're going to go on into skip the middle section, which is the vagina, because that's our hugest section to cover, and we're going to talk about the pelvic floor. Pelvic floor pain means that somewhere in your pelvis, which is the bowl that holds the ovaries and your uterus, and the top of the vagina. There's something dysfunctional with that. And so there are pelvic floor therapies that are provided by occupational therapists. You think occupational therapists are just for people who had strokes and they're trying to learn how to eat with utensils and read and do math. But really, occupational therapists, some of them do specialize in pelvic floor exercises. And be prepared, ask your doctor if these are one of them, because a lot of them do use manual manipulation, which means they will place their fingers inside the vagina to massage those muscles on the sides of the pelvis. This is really important because you can treat the middle section, which is the vagina, and if you don't treat that pelvic floor, you will not get any relief from the pain during intercourse. And the last thing we're going to talk about with the entry of the vagina hurting is some of us do have psychological trauma due to violence or trauma that was done on us at whatever age. If that's the case, you really have to talk to an experienced psychologist or psychiatrist that knows what to do with the information when you decide to share it with them. And the last part of the pelvic area that could be causing pain is you want to see if you have any conditions inside your body that could be causing pain when the object hits the upper part of the vagina into the pelvis. Is it an ovarian cyst? Is it endometriosis? Is it a uterine fibroid? These are all really important to investigate. And also a bladder condition called interstitial cystitis, which a urologist should really be looking at you if you have that. Now we're going to move on to the last and final section of ability to have sex without pain. The middle section, and that's your vagina. We want to talk about the vagina, about why it's dry, what makes it lubricated, botanicals, foods, and herbs that can help you, as well as some physical activity or treatments that can help. Why does your vagina stay moist? What causes vaginal lubrication? A healthy vagina stays lubricated due to a healthy blood flow plus a chemical called nitric oxide that we make ourselves. This chemical, nitric oxide, is made in response to shear stress, not stress at work, but shearing. That means friction, vibration against the vaginal wall, as well as sexual stimulation. When this happens, the fluid gets into the vaginal tissue. Isn't that cool? So this is going to help you to know how to treat your vagina if you know the basis of why our vaginas stay wet. First off, a lot of people's favorites are what vitamins and supplements can I take to keep my vagina moisturized or to reestablish some vaginal moisture. Vitamin D3 is really useful. 2,000 international units a day with calcium and fish oil. You know, and they also make vitamin D3 vaginal suppositories of 1,000 international units a day. You want to do the vitamin D3 vaginal suppositories for 8 weeks. The other supplements that's helpful is L-arginine, which is also found in foods such as nuts, peanuts, almonds, walnuts, and hazelnuts. We prefer you use a dietary source like that because if you take the supplement of L-arginine, it can cause nausea, high blood pressure, high glucose levels, which is hyperglycemia. So you do not want to use this if you have kidney disease. In terms of a diet, a wonderful diet to help with your vaginal dryness is a Mediterranean diet. This is eating fruits, berries, beans, chicken, fish, sunflower seeds, and flax seed. And a little bit of chocolate too. Next, we're going to cover things that have not been proven to help as much and why. We'll cover a few botanicals that might help, and at the very end, we'll cover things that you should not use at all. The things that have been studied that haven't been proven to help much are sea buckhorn oil. It's shown to improve the function of your epithelium, which is the skin, but it's really not shown to help the symptoms of vaginal dryness, so you'll still feel dry. Another one is niacin. Niacin does help endothelial dysfunction, so it helps improve endothelial dysfunction, but it causes us to be flushed, and it can make some of our skin disorders of our vulva, which is the outside of the vagina, initially worse when we first started. Let's move on to some botanicals that can help vaginal dryness, and some of the side effects that you might experience, so you can use these knowledgeably. There's two of them. One of them is American Ginseng. If you're taking diabetic medications, this may cause you to have insomnia or too low of a glucose level. And the second botanical that might help with vaginal dryness, but you still have to use with caution, is Ginkgo biloba. Ginkgo biloba inhibits platelet activation. So it can increase bleeding if you are taking a lot of garlic, or if you're on an anticoagulant, or if you're taking aspirin or a non-steroidal anti-inflammatory drug like Motrin. Lastly, these are 4 botanicals that are not recommended for use if you're trying to treat vaginal dryness. And I had them listed, so I don't want to miss any of them. Oral black cohosh, which means you're taking black cohosh orally. Topical gentian, red ginseng, and damiana. The reason that the first 3 are not recommended is they're not successful at helping vaginal dryness, but the last one, the damiana, what it does is unsafe because it may boost your unopposed estrogen activity. That's all I have today on painful sex. I think the most important is to always communicate with your partner and explain when something doesn't feel right, and always talk to your doctor.
Before we go today, we do want to remind you to please come to our Healthy You conference. It's going to be the first annual conference that we have in Jefferson City, Missouri. It's going to be a little bit different, actually quite a bit different than some of the other medical conferences you may have attended around town. It's actually going to be focused mostly on preventative care and wellness. And if you don't know what the difference is, the easy way to think about it is a lot of the things that you've gone to before, they're treating something you already have, like say severe arthritis or fibromyalgia or dementia or osteoporosis. This conference is going to be specifically focused on those things you can do to keep you from actually getting to those points. So it's very important, and again, we're going to be featuring a lot of the local physicians and providers in this area that specialize or have a special interest in using preventive medicine and wellness in their practices. So please come. We're going to be taking a break next week because we're going to be busy organizing and doing the final touches on Healthy You conference. That's going to be on October 19th. And so we'll be joining you that following Sunday, where we'll be discussing integrative medicine approaches to chronic pain management. For those people that have been to previous pain clinics before, they're on a lot of medications, or they've had all types of injections and steroids that really have not helped them. You're going to see a different approach, and hopefully you'll learn something. So long.
Bye, see you in our next video.